We just had an exciting meeting. Many of the people that were involved in that meeting are here now. They're stakeholders throughout in the healthcare system throughout Louisiana. Louisiana's come a long way in its healthcare system and the evolution of its healthcare system. We certainly have a ways to go, but we're making progress. And part of the reason we're making progress is we have so many committed stakeholders, so many committed people who want to be a part of the solution. Now, one of the things Louisiana has done that most other states have not done yet is it's invested heavily in the transformation of technology so that we can start using and harnessing technology and improving the quality of health care for the people that we serve. How many of us are, I use this analogy in the meeting we just had, how many of us are parents in this room that have had to wait at our pediatrician's office for our children to get our vaccination records so we could enroll our child in school or in Little League? Or how many of us have had to go from one doctor to another only to have to redo all the work that we just did at the other doctor's office? Or how many of us have shown up at the hospital and been asked about our allergies only to not really know the whole answer? And the fact of the matter is that in the healthcare world, in truth, paper kills. Paper records leads to poorer outcomes. Conversely, the use of technology leads to better outcomes. It's proven, it's a fact, and not only that, it saves a lot of money and it saves a lot of lives. So today we're so excited about having the administrator of the Centers for Medicare and Medicaid Services here with us. Administrator Weems has been one of the prime drivers behind the idea of moving America towards every American having a privacy-protected, interoperable health record. He's now the acting administrator of CMS, and he's also going to have a few other announcements. Before I bring him up, I want to share with you the governor's budget for next year related to the issue of health information technology. Some of this you'll better understand after the administrator makes his remarks about the initiative that he's rolling out nationally, and an initiative that the state of Louisiana is going to aggressively pursue with our partners. First, Governor Jindal's budget proposes spending $4 million towards the investment of infrastructure to create the central portal for the health information technology platform for the state of Louisiana. What does that mean? It's basically to create the infrastructure that we will be able to use so that all of our healthcare providers can communicate health information together. The governor also proposes $11.1 million for the Louisiana Rural Health Information Exchange. Senator Hines is here, Linda's here, representing the rural hospitals. And let me tell you, what they've done last year, so many of our hospitals in the state of Louisiana are rural, and they don't have the resources to first get to the first point of entry for electronic records, which is to have digital information systems in their hospitals. This year, because of the budget this year, 7 of our rural hospitals are implementing interoperable electronic health records within their hospitals, IT systems, if you will, and the governor's proposing to expand that this next year for 7 more hospitals. Finally, additionally, the governor's put $3.5 million in his budget to provide financial incentives to physicians who participate in the Medicaid program who utilize health information technology. This is important relative to the initiative that Administrator Weems and Secretary Levitt have given us the opportunity to potentially participate in. It's additive to the federal government. In my opinion, it's incredible foresight on our governor's part to try to make sure that we don't compete with what the federal government's trying to do, but instead we add to it. And we're going to use this $3.5 million to also encourage private sector plans throughout the state of Louisiana, our own state health plan, to participate as well. The governor also has put $1 million in his budget for the implementation of our transparency initiative. It's very important for the right of consumers, and we call it the consumer's right to know. It's very important in terms of the consumer's right to know the quality, the outcomes, the cost of health care. Any of us can go, when we buy a car, we can compare different cars, but we can't necessarily compare the outcomes of our providers. The people are going to care for our children and our parents and our families. And so the governor's put $1 million in his budget for the implementation of what we were going to call the Louisianans' Right to Know Act, which will give us the ability to publish outcomes not just for our hospitals, but also for our health plans, to be able to compare the performance of our plans in terms of quality, compliance with national benchmarks, and patient satisfaction. So with that, I'd like to introduce Kerry Weems, a great partner and someone who's been very good to the state of Louisiana, to make a few announcements. Administrator. Thank you.
Thank you. Good morning. Thank you all for coming today. And Secretary Levine, Governor, it's good to see you again. As some of you may know, the Governor and I are former colleagues from the Department of Health and Human Services. It's always great to see him and to be back here. I'd like to actually begin today with a presentation. The Louisiana Healthcare Quality Forum has become a chartered value exchange. Now, chartered value exchange for HHS means that you're going to be able to exchange information, be able to judge quality and in the healthcare, and that you've brought together the kind of coalition that's needed to really begin transforming healthcare in the United States and in the state of Louisiana. So I'd like to congratulate Dr. Michael Fleming on this award, and I'm going to try and get it out of here and do this successfully. Dr. Fleming. There we go. Right there. Good.
Thank you very much.
Yes, congratulations.
Thank you.
This is exactly the kind of leadership that CMS and the federal government is looking for in healthcare. And today we're here in Louisiana to announce another opportunity. The Secretary of Health and Human Services, Secretary Levitt, myself are going around the United States today and over the next several weeks to recruit communities to participate in an electronic health record demonstration project for Medicare. We're going to visit about 40 communities. There are certainly more than that are eligible. But in those communities, we're going to try and find 12 good applicants. I think there might be a good applicant here. And in those communities, we're going to recruit 100 physicians to receive a bonus from Medicare for the use of an electronic health record and for practicing high-quality medicine as measured by certain quality measures. And over the period, the demonstration period, Medicare will pay a bonus to those physicians. For an individual practice, that bonus could be as much as $58,000. For a multiple physician practice, it could be as much as $290,000 over that 5-year period. So we're talking real money. The thing that we're going to look for is the federal government is not going to come out and recruit your physicians. We're going to look for a community to come together and put in that application. And the thing that we're looking for in a community are the other payers, the provider community to be present, large employers, the political leadership, a true community to come together and to give us an application that says we can take the step in moving medicine into the 21st century by having our citizens be safer and by saving the healthcare system money through an electronic health record. So we're here today to have a discussion. We had a great discussion with many of the stakeholders. The state and Dr. Fleming's group has some work to do in defining the communities. We're not going to define what a community is. We're going to leave that to the applicants to define what a community is. That task, I think, will go to Dr. Fleming and to the state. So we're very excited about this effort. We're hopeful that we receive at least one application from Louisiana, perhaps more. Applications are due May the 13th, by the way. So that's I believe, a great opportunity for this state. I'm also here to announce that today the Department of Health and Human Services and the Centers for Medicare and Medicaid Services has approved Louisiana's expansion of its children's health insurance program. That expansion is for children up to 250% of poverty and family income. Family of four, that's about $53,000. And we expect that this great expansion will mean that 6,500 additional children in Louisiana will now have access to regular good health care through an insurance package. And I would like to extend my personal congratulations to the governor for submitting this package, for demonstrating his commitment to the children of this state. So congratulations, Governor, and thank you very much.
Good morning. It's an honor for the Quality Forum to receive this designation as a chartered value exchange. And we look forward to working with the Centers for Medicare and Medicaid Services and to the Louisiana Department of Health and Hospitals to create a better and more transparent health system for Louisiana. The poor health outcomes that for too long have plagued us in this state are not the result of bad people doing bad things. As the IOM has said, it's the result of good people working in bad systems. This will give us the opportunity to begin to build these new systems to improve these health outcomes. We're going to seek a broad input about health care in Louisiana. We're committed to getting information from every point, but we're also going to make sure that we inform all of our stakeholders about what quality in health care really means. And we hope that with time that consumers, patients, will begin to demand and expect quality care, and that providers will understand the importance of quality monitoring. So we salute our state for moving forward on this, and we look forward to working with all of you in this endeavor. Thank you very much.
I just want to briefly, first of all, certainly congratulate Dr. Fleming for the award he has received. We're certainly proud as a state. I want to thank Kerry Weems for coming here personally to deliver the very good news that our waiver application has been approved. This is certainly one additional step towards ensuring that all Louisianians have access to high-quality, affordable health care. Dr. Hines was in the Senate when the state created LOTCHIP, this program that has been a phenomenal success in Louisiana. It's actually one of the programs where Louisiana is ahead of many states across the country, both in enrollment and in terms of outcomes demonstrated. So we're thrilled to get this additional expansion in addition to stepped-up efforts to enroll children that are already eligible. We know this will help thousands of children, thousands of families get the health care they need, that they deserve, allowing these children to stay healthy, stay in school, and continue to lead productive lives. I want to also compliment the Secretary on the initiatives he mentioned. These are truly transformative initiatives. When you look at initiatives like electronic patient records, when you look at online posting of prices, outcomes, and results, these are the types of steps that will truly empower patients to have control over their own health care. These are the kinds of steps that are going to be necessary for Louisiana to move from the bottom of the good list to the top when it comes to health care outcomes. These are the steps necessary for Louisiana to move ahead of these other states. We're very eager to see the federal demonstration project, the federal grants, the federal dollars available through the Medicare program. I think that's an excellent program. I can guarantee to Kerry there will be at least one application from Louisiana, maybe more than one. We believe in this so strongly, we've put some state dollars in our own budget to make sure that in addition to what the federal government does, the states also incentivizing providers to use electronic patient records. The Institute of Medicine and others have documented this can decrease preventable injuries and deaths by tens of thousands across the entire country. It can save our country's healthcare system billions of dollars, but most importantly, it can improve the quality of health for our people. You know, I actually worked for a health secretary that used to remark, and I was sharing this with Linda and Dr. Hines previously, that he used to remark in some of our hospitals, we have better technology in our cafeterias and our gift shops than at the bedside. And what he meant by that was you had barcoding, automatic inventory, paperless records, and on the retail side of the hospitals, you see that in many drugstores, many grocery stores, many convenience stores, yet we still have a paper-intensive system when it comes to our healthcare records. And you contrast the automatic inventory systems at many retail stores. how they automatically refill their shelves with a paper-intensive process that's still used in many doctors' offices, many hospitals, that leads to additional costs, can lead to duplication of services, can lead to avoidable errors. The classic case is if a patient goes into a new doctor's office, is rushed to a hospital for emergency treatment, is traveling away from home, duplicate tests may be ordered simply because that provider doesn't have access to the previous records. It leads to worse outcomes and avoidable costs for the patient. So these are truly transformative steps that the Secretary is announcing. We're thrilled that HHS is also moving forward through the Medicare program. We want to be partners. We want to help lead the way. We want to be one of the states ahead of the rest. We want to be one of the first states to promote adoption of this technology. Not only does it save money, it also improves quality of health care and can literally save lives. So, Kerry, thank you for the wonderful announcement. Secretary Levine and I actually traveled to D.C. a few weeks ago to meet with Kerry, to meet with the Secretary, to advocate for the approval of the waiver. We're pleased to see the decision today. Again, one small step forward in terms of providing quality health care for thousands of Louisiana families.
We have somebody that we really want you to hear from. Ms. Warren is a patient who has been served by having an electronic health record, and her physician, Dr. Brooks, are here. And we'd like for you to hear from them as a real testimonial to the difference that this initiative has made in her life. Ms. Warren, thank you for coming.
Okay. I was in Hurricane Katrina, and I evacuated first to Georgia. Then I came down here to Baton Rouge. Then I went to New Orleans. And I became ill in October of 2006. And if it wasn't for the electronic system that auctions have in place, I don't know what I would have done, because they had all my records, all my allergies, and I didn't have to waste a lot of time going and get paperwork from here, from there, all over the place. But auctions had this in place, and it was a lifesaver, really. And when I left auction after surgery in New Orleans, and I came to Baton Rouge, Dr. Brooks was my physician. And with his help and auction system in New Orleans, my treatment just went smooth. Didn't miss the beat. You know, they knew what allergies I had. They knew what tests I had. They knew what physicians I've seen, what past medical problems I had. And everything, you know, especially that allergies, because I have several of them to different medication, and it hadn't been for them, I could have had a real bad allergic reaction. And a different medication, I didn't even remember what the strengths of the medicine I had, but all this was in the system. So it was really helpful to me and my family. And I would urge everybody to try to talk to your physician, talk to your friends, talk to your family members, to get this in place, because it is a lifesaver. Even if you go out of the country, if you go in other areas of the United States, if you have this in place, all I have to do is type your name in, social security number in, your birthday, and wow, there it is. You know, emergencies comes up. You know, you don't really know when that's going to happen. You may never have had a heart attack before. But they can go in there and say, well, okay, they never had this, or they never had that. We can give her this, or we can give him this. So I really urge all of you out here to talk to your family, your friends, to get this in place, because it's a lifesaver. Thank you.
I'll just say that electronic records are transforming. In the 70 years of Ochsner's history, when we moved from a paper record to an electronic record, it truly allows you to better serve your patients. Patients have instant access to their records. It is their record. They can see it, it's transportable, and it's something that is the best thing for patient care, patient safety, and truly is a cost saver. Thank you.
There's a few things that were announced today. First of all, they announced, the federal government announced their approval of our waiver to expand coverage for health insurance to our children that are up to 250% of the federal poverty level. That's a huge announcement for the state of Louisiana, because one of our primary objectives, and one of Governor Jindal's primary objectives, is to expand access to health care for children. It's one of our most vulnerable and certainly it's the future of our state. It's one of our most vulnerable populations, and it does represent the future of our state. So the health of our children is very important, and it's something we're investing heavily in. This year we'll invest more than $5 million into that expansion. The other thing that was announced is a very exciting announcement that's going to have dramatic impact on the improvement of health care for our families and our state, and that is an initiative by the federal government to provide financial incentives, substantial financial incentives, up to $58,000 for an individual physician and up to $250,000 or so for a group practice, to incentivize them to adopt electronic medical records. We think it's so critical for the improvement of health in our state, in the country, frankly, to comply with the President's initiative to make sure that every American has a privacy-protected electronic medical record in the next 20 years. Louisiana is one of the states that's leading the effort, and this is just another example. With the governor's budget announced today, we're investing $3.5 million, in excess, actually, of $18 million total in the governor's budget for this initiative. So we're demonstrating a lot of real aggressive foresight in the development of our healthcare system, and we're proud of it. I think Louisiana can be extremely proud of its governor today.
Are you encouraged by what you've seen here today?
Very. I joke about the number of the smallest book in the world is Republican governors who can talk about health care. I think there's about 3 of them and really know what they're talking about. Governor Jindal does. What's exciting for me is coming to work every day and knowing that I can sit and talk to my boss, and he knows as much about the topic or more, frankly, than I do. And it makes my job more exciting, more fun, and quite frankly, again, I'll tell you, I think I'm proud, and I think Louisiana should be proud of the commitment this governor is making, whether it's mental health, improving our mental health system, whether it's improving information technology for health care, whether it's trying to push to provide more choice to our families. This is a governor that truly understands our health care system and wants to see it improved, and I'm proud to be part of his administration.